we need to just log roll this one on her so she can roll towards you guys. Basically.
Let them help you.
Yeah, you don't do nothing.
No, you're. Oh.
Sorry, my hands are in like crazy places right now. Okay.
Sorry.
We don't want as much fabric on this side because we'll turn her towards you guys, okay? So we're gonna give them a little bit more fabric and keep the fabric not so much on this side. And then we're gonna roll her back. They're gonna grab that side out from underneath her. And they'll have more fabric overlaying that way. So then this side, we're gonna be blind. You guys are gonna do the catching. We're gonna do the turning, okay? So we're gonna come down. And the first couple, you want on, we might have to move this up just to here. On loop number 1 or closest to the pad. And then the second loop, you want on number 2. That's fine. You want to place your pillows across the top. There you go. Anita, and the pressure points, you want to tell me?
Over the groin
Kind of over
area.
Yeah.
This one's kind of crunched up. So one pillow or wedge over the groin. If we're using wedges, they're with the pluck and pull section that goes vertically. Pillow over the chest area, and if you're using pluck and pull, it's the horizontal pluck and pull that fits the size of the chest that you use up here. Pluck and pull side down to offload either the groin or the breasts.
Then you want someone just to focus on the head with the lines, the ET tubes, and any of the IVs. And then as we're going up, we're going to move her closer towards this side of the bed. So Tracy and I are going to go up. And we're gonna, as we're going up, we're gonna slide her this way. Okay, and the more she comes up, the more we slide. And as we're sliding, this side of the bed's gonna be tucking this blue pad, the turning repositioning sling, underneath. And as she's gonna go over, you're gonna lose vision, and you need to let them know, I can't see, so they can help tell you when to stop the sling from going up.
Arms stay down at the sides during all turns.
Pull her just a little bit more. Okay.
And there we have
And
it.
there she is.
Now you may need to do some repositioning once you're prone,
She's pretty sweet.
moving
Watch her.
pillows or wedges in place. As you can see here, we are a little lopsided on this pillow, so we would need to reposition that under that side of the chest. In which case you just log roll and move or add another pillow.
Oh yeah, we can just add this pillow.
You can always add another pillow. Now with the wedges, we don't have that luxury, so that's the importance of trying to have them actually positioned while you're sideways.
And her
The other
arm?
part that we have not talked about is your EKG leads. You remove them prior to proning, and then you place them in the same positions on the back. So we don't want people lying on EKG leads, they're gonna be posteriorly placed. Now as you can see, we just moved an arm, and how you move that, you drop it down to the side, and then roll, move it up. Follow the natural tendency of the ball and socket. Never force. If the patient's too stiff, then just try to, little bit of an early range of motion, try to move it a little bit. You wanna try to reposition arms and head every 2 hours, and then you tilt side to side every 2 hours while in the prone position. The normal time, length of time you'll stay prone is 16 hours. And then 4 hours supine, 16 hours prone. The next things that you wanna do after they're in the prone position, make sure the airway is set, make sure the head is offloaded, and then we would put pillows and or wedges, if you're using the wedge packet, underneath the legs to offload the knees and the feet. You don't want the toes. I'm gonna bring Sam's toe down here. See how that toe then would be touching the bed? I don't want them touching the bed, because they'll get a DTI from that.
Okay, so now it's
Now, after this, we place the patient in a 30-degree reverse Trendelenburg position. Sometimes when you do this, the patients automatically get a little bit better. There's going to be a 5 to 10 minute, in some patients, delay in their SpO2 and oxygenation getting better once you do all that movement of proning. So don't be fearful, just wait a little bit. 5 to 10 minutes can be a long time, but then the patient stabilizes out. I think that's it for going prone.
Yeah.
So we wanna
We're gonna
video,
go back.
stop here and we'll video, do them back.